If you've ever felt unheard, unseen, or like the wounds from your past still hold you back, you're not alone. This space is for you. Here, we heal, we grow, and we rediscover who we truly are. Beyond the pain, beyond the past. And if you're ready to step into your healing journey and finally embrace your authentic self, hit that subscribe button.
Anyhow, we have PTSD here, which in some ways has been a profoundly important definition in that it gave a voice to people who are really suffering and who are otherwise diagnosed as, well, it's just in your head, or these people are suffering, it's not flashbacks, but paranoid schizophrenia and so forth. So anyhow, we'll see how I start to work with Ray with this explosion, with his shock reaction, so that we're then able to afterwards process the emotional components. And unfortunately, there are times when I'm talking, so you'll have to listen to me.
In this video, you will see Ray, a Marine who was blown up by 2 explosive devices in Iraq. He served in Iraq and Afghanistan. And you will see how he moves from being really severely debilitated by PTSD and other issues.
I don't like it when people take care of me. I can't stand it. So
you want your independence.
Exactly. I wanted my independence.
So again, I want you just to see his body and to see how your body resonates with his. To notice his aversion, his hiding. And the first, I guess you could call it a now moment, was when I reflected back to him, and you want your independence. Because again, to think about this, a warrior, one moment a warrior, the next moment totally helpless. Yeah.
Independence back, and I don't like the idea of being a burden to somebody. In the beginning, I had to kind of teach myself how to walk, talk, and think again. I guess every day it's been getting a little better, kind of.
What kind of medications are you on?
Uh-oh.
You remember?
They got me on like 6 or 7.
Do you know what they're for, supposedly?
Pain.
In fact, Ray had been prescribed a cocktail of powerful medications, not only for pain, but for PTSD, TBI, traumatic brain injury, Tourette's syndrome, and depression.
By the way, Tourette's syndrome doesn't usually occur in a moment, but
the involuntary movements that you make with your head and neck like this, when did that begin?
I want to say like a month and a half after the blast.
That's typical, by the way.
Now, I'm going to give you an idea, and we'll see where we can go with it, okay?
Okay.
See, the movements that you're making are the kind of movements that your body would have made if there was an explosion. You know? And what it's doing is it's kind of repeating those movements over and over again.
And that's what the body does in trauma. It replays the trauma over and over as somatic signs and symptoms. That's really, really important, really important. That it's not primarily about the memory, but of the recycling of what you could call a procedural memory, the body memory in quotes, and how it gets stuck. And how sometimes if we know that and we can access it, that something that's so severe can actually change literally in moments, as you'll see, because in the next session, the convulsions were really mostly gone.
It's sort of like it got stuck there. And I'd like to see if we can get you some tools so you can stretch this out.
See the convulsion.
These reactions are a little bit softer. I want to have you very slowly.
And you see now he's interested. He's making a little contact.
Very gently. Opening and closing your mouth, just the smallest amount. And then come back a little bit. And then just go to where you feel a little resistance. That will...
And what I'm doing here, because I could see when he would go into these convulsions, I could see that the jaw clenched first, and then that spread down the neck and the shoulders. I could also have worked with his neck or his shoulders as well, but this is the linchpin for that response. And if we can get underneath that radar, then it will dissolve.
Trigger those movements probably, but will also give you a chance to feel what's going on before the jerks, okay?
All right.
So let's just do that together, okay? Did you feel what happened that time?
It was just a tingling sensation in my body.
Exactly. What happens
And that's an indication of relaxation, tingling, warmth.
when you exposed to something like you've been exposed to, I mean, being in a war zone, and then having an explosion, it's almost like you get jolted right out of your body. And so what we're doing is calling it back into your body.
When someone goes through a tough experience, it's hard for them to feel safe. Talking alone might not help because trauma affects both the brain and the body deeply. So, how can we help people feel safe, even when they're not with us in the office? Dr. Peter Levine will show us 2 simple techniques that patients can use on their own to calm down and regulate themselves. The cool thing is that you can share these techniques with your patients, and they can use them anytime, anywhere. Let's listen to Dr. Peter Levine.
When a person's feeling traumatized, is traumatized, nothing feels safe. Almost nothing feels safe. And as therapists, what we want to do is to be able to convey, at least in the smallest amount, an island of safety. That there is a way that you can feel safe, that something has happened to you, you survived it. Now we're going to go back and pick up some of those pieces that you left behind so you can be whole again. The other thing that's important in trauma therapy is that as soon as possible, that the therapists also provide tools, help the client learn tools that they can use to help them feel relatively safe. Because if the only place they feel safe is with you, the therapist, then when they leave and then they start feeling, horrible again, terrified, helpless, then sometimes, very frequently actually, they'll kind of shame themselves, what Fritz Perls called the top dog, because you're not able to. They're more dependent. They're completely dependent on the therapist. And so if we can give them even the smallest tools for self-soothing, for self-regulation, and I mentioned a number of them. I demonstrated a number of these with a person, with a client. Okay, here you take your right hand and you put it here under your left arm on the side of the heart. Yeah, got it. And the other hand on the shoulder. And just to get a feeling, Ruth and everybody else who's watching, what this feels like, what the sensation is like, not just of your hands, but of what's going on inside of your body. Most people report a settling. What this does, I believe, is it helps us become aware of our container. See, and we'll probably get into this a little bit more. The body is the container of all of our sensations and all of our feelings. It's all in the body. And this is the container of the body, is the kind of the outside of our body, our shoulders, the sides of our thorax and so forth. And when the person can feel the container, then the emotions and the sensations do not feel as overwhelming because they're being contained. Another very simple thing people can do, usually I suggest they do this one first. The second one is just putting a hand on their forehead and the other hand on their upper chest. And just to wait, they can do this with their eyes open or closed, whatever they feel more comfortable with. A lot of people like to do it with their eyes closed, or others don't feel safe enough. To just feel what goes on between the hands. Sometimes they'll feel like an energy flow or a change in temperature or a feeling. And I just ask them just to keep their hands there. It could be just a few moments. It could be 5 or 10 minutes until they feel some kind of a shift. And then to take the upper hand here, keep the lower hand on the chest, and then put this hand on the belly. And again, just wait until there's some shift, till there's some flow. And sometimes people, if they're unable to sleep or they're afraid they're going to have nightmares, if they do simple things like that, they fall into sleep much better, and often the dreams are much more useful dreams. There are other techniques, the tapping, the energy, psychology kinds of things. For some people, that works very well. Other people, you can use like tapping. Another thing I suggest is actually literally tapping the skin all over so you get a sense of the boundary, because traumatized people, there's a hole in their boundary. So as you kind of help the body remember that it is the container, then they feel more able to deal with their sensations and their emotions. Also, squeezing the muscles, different parts of the body, also helps with boundary, sense of boundary.
When trauma takes over,
Healing takes time, and you don't have to do it alone. If this message resonated with you, know that your journey matters. Be gentle with yourself. Keep exploring and surround yourself with support. If you haven't yet, subscribe and join this community. We're in this together. And before you go, comment, "I am healing to affirm your growth. You are seen. You are valued, and you are not alone."